Welcome to HealthWatch, presented by Novant Health. I'm June Baker, and I'll be your host today. We have a pretty exciting show for you today. We're going to talk about some therapies that are offered at Novant Health, as well as some spiritual care opportunities that we have here at Brunswick Medical Center. Our first guest today will be our chaplain, Rona Watson, and she provides spiritual care services here at Brunswick Medical Center. And our second guest is Emily Benoit, and she's the speech-language pathologist with Novant Health Rehabilitation Center, and that's located in Charlotte. And our last guest will be Lizzie Tumulty, and she's the occupational therapist at Novant Health Rehabilitation Center, also in Charlotte. So stay tuned for these topics on HealthWatch. First, let's welcome Rona Watson, who provides spiritual care services here at Novant Health Brunswick Medical Center. Rona, thank you so much for sharing your time and talents with us today.
Absolutely. Thank you so much, June, for giving me this opportunity. This is very exciting to be sitting here beside the great June Baker.
Oh, yeah, right. Okay, Rona. Now I'm blushing. So, tell me, how do you get started in being a chaplain? How does that happen? I want our viewers to get to know you a little better. So tell me how you got to where you are.
Well, I think first of all, for me, personally, I've just always had this innate drive to ease the suffering of this world, right? So that coupled with the ability to see it, right? Because a lot of us can afford to just be able to look past some of the suffering in this world, which is what we do to get through it. But for me, it's just a gift, I call it now, to have that desire to want to ease the suffering of this world. And
But what kind of education do you need to get to that point?
So starting with the gift first, right? Because someone once said that anybody can take a picture, but not everyone can develop the film, right? So how do we get to the point to where we can develop the film or to become a chaplain, right? And so it starts out with a master's degree in divinity. Then there is a 2-year residency that you do with a hospital that is offering clinical pastoral education. And then you go through and you can volunteer with hospitals, with hospice, with agencies in the area. But it does start with that foundation of having a master's in divinity and that foundation of going through the clinical pastoral education classes with an accredited institution.
Good information. I didn't know all that. Well, how long have you been a chaplain with Novant Health?
Today, here at Novant Health Brunswick Medical Center, today is my 1-month anniversary.
Nice.
All right, yay. Okay, and then, so I've been with New Hanover Regional Medical Center for over 15 years.
Really?
For over 15 years.
I didn't know that, Rona.
Yep, over 15 years I've been there. Yes, and so what got me here, so the journey to here, I started out my residency at New Hanover Regional Medical Center, and at that time we did not have staff chaplains, so you can volunteer as a chaplain there, and that's what I did. I volunteered for a few years. I became a chaplain with the Wilmington Police Department for a few years. Then I went to hospice care, so I was a chaplain for a hospice agency. And then it was time at New Hanover where we began to have PRN chaplains, as needed chaplains. And from there, I was hired as a staff chaplain with New Hanover. So.
Wow, that's a great journey. And we're so glad you ended up at Brunswick Medical Center.
I am grateful. I am grateful. Very grateful.
So tell me about your role and the mission of spiritual care inside a hospital. What does that look like?
So with Novant Health, we want remarkable. So
Right.
we want remarkable spiritual care. All right. And so with that in mind, the spiritual care department with Novant Health Spiritual Care Department, we want compassionate presence, we want courageous conversations, and we want meaningful connections while we're on this journey of life. And so what it looks like, that compassionate presence, June, we don't all volunteer to come to the hospital and be in a room.
Right.
We don't sign up for, I'm going to be under the weather. I'm going to be sick to the point of needing to be in the hospital on this date, right? And so what happens when there's a patient at the hospital is innately life interrupted, right? So it's life interrupted. So they're in this space and in this place because of something that happened most of the time out of their control, right?
Right.
And so they're at their space and place of vulnerability. And so one of the things that we do as chaplains is we go into that space and allow that person that is in that point of vulnerability to know that they are not in it alone.
Yeah.
Just to know that they are not in it alone.
I want to kind of move on to end of life. I imagine that you get involved in a lot of conversations surrounding healthcare choices and about care involving end of life issues. So how do you bring that topic up? Is it usually brought up by the patient or the family member? And how do you navigate that?
Well, we have this now at Novant Health, and maybe for many years now, we've had Choices and Champions.
Right.
Right. And so we partner with Choices and Champions who really help to navigate or to facilitate, actually, the healthcare power of attorneys and the advanced directives. So working along with the care team, because chaplains are a part of the care team, the spiritual care department is a part of the interdisciplinary team. Usually, when a patient enters into the hospital, there are a list of questions that are asked, and within that list of questions, it's asking about do you have the healthcare power of attorney or a living will? If the answer to that is no, would you like more information? If your answer to that is yes, I would like more information, then there is a consult that is put in, and we are asked to go and see the patient just to give them more information if they need the education materials. And so generally that's usually most of the time how the conversation begins. And then we just explain the healthcare power of attorney and the living wills. There are times and instances where the patient and family, they are uncomfortable having this conversation. And so what I say to them is, it's just important to have the conversation. Just have the conversation.
I know that you deal a lot with sorrow, with a lot of joys. We have babies born. We have grandparents who pass away. And I know you deal with it. How do you personally remain uplifting and see the bright side of things? How do you maintain that from a personal perspective?
It actually starts with appreciation. It starts with appreciation. This drive that I have, and now I call it a gift, I have to say it that way now, to help. I just want to help. And so I am afforded the opportunity with great appreciation to enter into a space and a place of vulnerability and to be able to help you traverse this journey that you're on. And so how it helps me is that I'm just appreciative because you don't have to do it. You don't have to welcome me. You don't have to. And so that appreciation. And then there are times when I scream and I yell and I dance and jump up and down on the bed and all those other things. But I'll give you the short answer.
You have a great smile and you're always so upbeat. And that's sometimes it's hard to be that way, especially if you've been sick and for a long time, for a long period of time. So something like that. And do you have one or two words of advice for family members or patients who are going through some hardships or whatever, what is it that you like to stress to them?
Breathe.
Breathe.
I think if there was one word, it would be breathe. And the reason I would say breathe is because breathing is something we all must do. Right? We all must do. So just breathing, it causes that connection with the entire world, because everybody has to do that. And then when you breathe, you take a moment to know, okay, I'm breathing, so I'm still here. I may be in pain, but I'm still here. I know this chaos might be happening, but I'm still here. I know that with my family member, there's impending death, but I'm still here. Right. And so even when we talk about end of life, we're really not talking about the best way to die. We're talking about the best way to live and all of that. Yeah. So I would say breathe and remember that you're still alive.
Yeah. Before we close, do you have a special mantra or a motto that you live by?
Okay, so Sa'ubona, all right? Sa'ubona in Zimbabwe means I see you. And I always like to use that word because for me, in that language, it's just saying hello, right? But what it means on that deeper level is I see you.
I see you.
I see you, which just means wherever you are, even if you think you're by yourself, I see you. And wherever you are, I know that excellence is taking place, so I see you. Yeah. And wherever you are, if I hear or I say Sa'ubona, that means I get to be there too. Yeah. So I see you.
Rona, thank you so much for being here. You've made me feel better.
Oh.
and I'm sure you make our patients feel better. So thank you for all you do for our patients and our community. And it was a pleasure to have you.
Thank you. It was a pleasure being here. Thank you, thank you, thank you.
Please welcome our next guest, Emily Benoit, the speech-language pathologist here at Novant Health Brunswick Medical Center. Emily,
Hi.
So nice to see you again.
Good to see you too.
Yeah, I'm really happy that you're here. And so I wanted to talk a little bit about how you become a speech pathologist. Talk about your training and the process to get there.
So you have to get your master's degree. We haven't switched to the doctorate yet, like OT or PT has. So I did 4 years of undergrad and then 2 years of my master's program. And then following my master's program, we have to do what's called a clinical fellowship year. Oh. And that's a 9-month fellowship. You work a full-time job, but you're being supervised by another speech pathologist during that time.
Oh. You look too young to have done all that already.
Yeah. Good genes, I guess.
Good genes. That's what I say. Were you always interested in this field, or did something happen that drew you to that?
So my mom is a nurse, and so I knew I always wanted to go into healthcare, and I had considered nursing, but I thought about it when I got to high school, and I was like, I don't know if I can handle like death all the time, and which is really ironic given what I do now. Yeah. I always knew I wanted to go into healthcare, and I love psychology. And so when I got to my undergrad, I took a Intro to Communication Disorders class, and I liked it, and I stuck with it. So
So tell me, who all benefits from speech services? I know it's pretty varied, but you provide it for all sorts of different maladies. So.
Yep. So we serve people across the lifespan. We see, not at this hospital, but somewhere like New Hanover where they have a NICU. You can see babies in the NICU, helping them with swallowing, sucking. We do, toddlers, early intervention age, school age children. We do the geriatric population. We help people at end of life. We work in a variety of settings, so schools, private practices, obviously the hospital setting, skilled nursing, home health. So it's a very varied profession.
So you do see pediatrics then. So what would the teens and the pediatrics benefit from? Mostly from a speech perspective, or of course when they're babies, the sucking and the...
Yep. So again, like children that are in the NICU, that sucking, swallowing, some children can benefit if they're like a picky eater. Sometimes we see that with autism. Some kids who have various disorders they might be born with, they might have trouble swallowing. We also service children who might not be able to say certain sounds, so we call that an articulation disorder. The classic one everyone tells me is like, oh, so like when my kid says wabbit instead of rabbit, that's an example of one. Yeah. Children who are delayed in their talking, children that stutter, those are kind of the big ones we typically see.
I think I have a grandchild that needs to see you.
Probably. It wouldn't surprise me.
He's 5, and some of the words just, they're not coming out right. Yeah. So talk to me about swallowing tests. I understand there's a new method,
Yeah, so there are 2 major swallowing tests that speech pathologists do. One is called a modified barium swallow study. So that's one we've been doing here forever.
Yeah, I've had that one.
Yeah, most people aren't a fan of it,
No.
but it is really easy. The patient comes in, we give them different consistencies, different foods, liquids, and essentially take an x-ray video. Takes maybe like 5 to 7 minutes. The other test we are working on starting a program for is called a FEES, so it's a fiber optic endoscopic evaluation of swallowing.
Wow.
Big word.
Big word.
But essentially what happens is we scope the patient through their nose, so we send the camera down and it hangs out right above the vocal folds and the trachea, and we give them different consistencies and see how their swallowing is. It's really nice because you have the flexibility to give multiple trials because you're not under radiation, and then also if we have patients in the ICU with all the equipment, we don't have to bring them down to radiology. So
that's interesting.
Yeah, it's really cool.
I understand that you have a voice therapy approach for patients with Parkinson's disease. Tell me a little bit about that.
So our outpatient facility was awarded a grant through the Parkinson's Voice Project. So that is for a specific Parkinson's voice therapy called Speak Out. So the patient would come in for 12 to 16 sessions, depending on how much support they need. Maybe 3 to 4 times a week, sometimes twice a week, it just depends. And after they complete that program, they join what's called a Loud Crowd. So the Loud Crowd is basically a built-in support group for people with Parkinson's who've gone through the program, and we practice the exercises together. So it helps keep those skills up and kind of helps hold people accountable, which is really important with Parkinson's.
Talking about holding people accountable, once they're discharged from the hospital, or if they're not in therapy like every day in their home, are there methods that they can keep up that therapy at home on their own? Yep.
We actually want everyone who's in speech therapy to be doing our recommendations or our strategies or exercises at home every day. Because that's really the only way things are going to change. So you have to do it every day.
It's kind of like physical therapy. You have to do it at
exactly.
home.
Yep.
How about referrals? Do patients need a provider referral for speech therapy?
That would be my recommendation. Yeah, typically we see a provider referral, and it's also good so they can follow your care. Sometimes I have to ask providers for, a PCP might refer a patient, and I'm like, hey, actually I think they really could use a neuro consult or an ENT consult. So having them involved is really important so they know what's going on.
Yeah, absolutely. So I was going to ask you if there's much difference between the therapy that's provided in the hospital versus what's provided in the outpatient setting. Is there a lot of difference, really?
Yeah, I would say there's a pretty significant difference since I've worked in both settings. I kind of think the acute care setting is you're coming in, something has happened, something has changed, and we want we kind of want to stabilize you at the acute care level and get you to the next level of care for where you need to go. So my role typically is more of an evaluation diagnostic role. So seeing what's wrong, identifying a problem, doing those evaluations, and then kind of giving the next person who's going to be treating the patient an idea of what's going on. We also do a lot of end of life and more critically ill patients at the acute care level, which you're not doing at outpatient.
Right.
So outpatient tends to be more rehabilitative, maintaining skills, developing strategies, learning new skills like in pediatrics. So very different but overlapping things that we do.
Are there many misconceptions about speech therapy, and can you share those with me?
Absolutely. I think the biggest one that I always get is that no one knows what I do. So I'm like, hey, I'm Emily, I'm a speech pathologist, and they're like, what is that? So just having more people aware of what my role is and how important it is, I think that's the biggest takeaway, I would say. So.
Well, you sound like a busy young lady, and it sounds like you enjoy your job.
Yes, I love my job. I have the best job in the world. I get to see and do amazing things every day. I had, for example, a woman this week who was able to eat solid food for the first time in 2 years, and I got to give her that news. So, I've had,
wow, that's amazing.
Yeah, I've had people talk for the first time after being intubated with COVID for months. It's amazing.
Wow, that's amazing.
Yeah.
Well, thank you so much for coming today. Our time is short, and but I'd love to have you back.
Yeah.
That's a great topic.
Yeah.
And like you say, we need more information out there.
Absolutely. Thank you so much for having me.
You're quite welcome. Finally, let's welcome Lizzie Tumulty, occupational therapist at Novant Health Rehabilitation Center in Charlotte. Lizzie, thank you so much for being here.
Thanks for having me.
Yeah, it's great to meet you. Last month we talked about physical therapy, and recently we talked about speech therapy, and so now I need to learn more about occupational therapy. So tell me about what kind of education you need to become an occupational therapist.
So you need a master's degree to be an occupational therapist. And so I specifically went to a program that was a BSMS combined program.
Oh, nice. Yeah.
So I was able to complete it all in 5 years at Towson University up in Maryland.
Oh, nice. So, did you have some reason, or did you always want to be an occupational therapist? How do you get there?
So I kind of stumbled across it while I was kind of making career decisions in high school, trying to decide what I wanted to do next. And my baseline was I didn't want to do a desk job. I wanted to do something where I was up and moving around. Oh. And I came across occupational therapy and just love how you can start working with across the entire lifespan, and you can work in so many different settings. So as a high schooler having no idea what to do, I was like, well, that's going to be a good place to start.
Right. Well, I think it's a very unique career. I just love all the toys and all the things they have, all these resources to give you to help people, and I think that's exciting. So talk to me about the purpose of occupational therapy. What does that bring you?
So occupational therapy helps people recover through rehabilitation through meaningful activities. And then also, like you're talking about the cool little things that we give people, we help with adaptations. So if there's certain challenging activities or tasks you can't do through rehab, then it's great to have adaptations.
Just like putting your socks on.
Yes.
And things like that.
Yep, so putting socks on, handwriting, eating different adaptive utensils. There's a lot of things that we can change to make life easier for people.
So give me some reasons why folks would need occupational therapy. What might have occurred in their health that would require occupational therapy?
So many different reasons.
Really?
Specifically in outpatient, it's just anything that if you have decreased range of motion in your upper extremity, decreased strength, decreased coordination, anything that has impacted you and make doing things you need to do on a daily basis more difficult. So like if you find you're no longer able to do your buttons or no longer able to brush your teeth in the morning or put on your pants, anything that becomes more difficult to do, it's a great reason to come to see OT.
And that could have been caused by an accident or a disease or a stroke or
yes.
something like that.
Yes, so it could be,
lots of things.
Yep, it could be from tendons, muscles, bones, nerve.
Wow.
Yeah, it's really covers a lot.
Yeah, that's pretty cool. Do patients need a referral from a provider to see you?
We do recommend people get a referral before coming in.
Well, I would think they probably already discussed it with their primary care or their surgeon, and then the referral would result from that visit, most likely. So when you have a new patient, tell me what your assessment looks like.
So I start every assessment by asking the patient what's wrong and why they think they need to come to therapy. Because even though I can read a chart and see why they're there, it's good to hear their own perspective. And then I start with a general screening, check out their range of motion, their strength, their sensation, and then based on the screening, I can take a deeper dive into any specific body part that they're having problems with. And I usually end my assessment with some grip strength and coordination testing, just to make sure I cover everything.
And then you come up with a plan of care for the patient, and so they know what they're in for. Is that correct?
Yep, and we talk about that
you
together.
Have goals and.
Yes. And so one of the great things about OT that I love is we can make very specific goals for something that, like, if they can't do buttons and they want to be able to button up their shirt.
I can't do buttons either.
Yeah.
I think I'm gonna need you.
So if that's something that they really want to be able to do, I can make a goal for buttons. And so I try to make the goals specific to what the patient wants, and then also based off of the, what the numbers show as well during my exam.
Yeah. So if you were there, say you were having trouble with dressing yourself, how long might that therapy last?
So it really depends.
Probably depends, I know.
I'm sure you've heard that from everyone.
Yeah, I heard it
from the
everybody,
therapy.
Sorry.
But on average, I would say, we usually start with 6 to 8 weeks, and then I can always extend if needed, and we can always stop early if someone's met their goals already. Usually neurological problems take longer to recover. It's slower recovery. So.
And then I assume they practice at home. Of course, if it's a dressing issue, you have to get dressed every day. So that's kind of your therapy, right?
Yep, and I do give people specific exercises to complete, and just tasks that they should do at home as well.
How about family involvement? Do you encourage the family to come along with the patient to see how the therapy should be going at home, or do you often encourage that?
I do. I think it's really helpful for the family members to not only understand what's going on, but also be able to be involved and help with those home exercises.
I know that when you're talking in therapy, sometimes if you're impatient, like I am, you want to get better faster. Is that typical? Do people want to get better faster, and you have to bring them back down to?
Of course, everyone wants the quick fix.
Of course we do. Give me a pill.
Unfortunately, that's not how it works. But it's just celebrating every single tiny milestone. Every little success is one step closer to recovery.
That's
so
awesome.
Keep that motivation.
Yeah. Is there any topic we didn't cover that you would like to share with us?
I think that about covers it.
Well, I want to make sure that we heard all your important messages, and I think you've done a great job at this, Lizzie. You're the first occupational therapist I've ever interviewed. So it was quite interesting, and I'm really glad that you were my guest today.
Well, thank you. I'm glad to teach everyone a little bit more about occupational therapy.
Yeah, we're getting the word out. Well, thanks again for being here. Hope you'll come back soon.
Thank you.
You're welcome. Thank you for tuning in to HealthWatch today. I hope you enjoyed the show. If you'd like more information about services provided at Brunswick Medical Center, or if you're in the market for a new physician, please visit our website at novonthealth.org. Thanks for joining us today. Be sure to join us next time for HealthWatch.